The U.S. House of Representatives continues discussions surrounding the big, beautiful bill. Ballad Health is urging lawmakers to stop their work. Good evening. I'm Kristen Kwan.
And I'm Casey Getz. In an exclusive interview with Ballad CEO Levine, News 5's Liam Bridgman breaks down the effects the bill could have on our region's hospitals.
It's a huge cut, and it's going to really have a negative impact on rural hospitals all over the country.
That's President and CEO of Ballad Health, Levine, speaking out against major changes to the newest version of the big, beautiful bill.
They're going to need to come back and figure out how to fix it, or they're not going to have hospitals in rural America.
Levine says earlier this week, state health leaders in Tennessee approved an increase in what's called the Medicaid provider tax, a mechanism used to boost federal Medicaid contributions, leading to additional revenue for healthcare providers. The approval also allows an increase in state-directed payments, which brings in significant additional revenue to hospitals, especially in rural areas. But after modifications made to the federal bill, Levine says the changes made in the state of Tennessee won't have a big impact, and Ballad could face significant losses if the bill is passed.
The combined effect of those losses, it's at least $25 million in the first year. It becomes $50 million in year 2, $75 million in year 3, up to the 5th year. It's at least $125 million of annualized cuts.
Now, Levine says if the bill's passed, Ballad will be forced to make tough choices, especially around rebuilding Unicoi County Memorial Hospital, which was completely decimated by Helene.
The cost to build that hospital is $50 million. How do you rationally, and it's not just Ballad's money. I mean, there's $10 million that's been provided by the state. There's FEMA dollars there, federal tax dollars in play. How do you build a hospital for $50 million knowing that in the first year you might have to close it?
The Senate, in response to these changes, added a $50 billion rural health transformation fund with the intention to curb the decline in revenue for rural hospitals. But Levine says the majority of Ballad hospitals wouldn't be able to access that fund.
If this language isn't fixed at some point, it's not just going to be Unicoi that's impacted. You can't go from a less than 2% operating margin, which is what we'll report this year, to losing $125 to $200 million a year and be able to sustain this business model. It's just not, it won't work.
President Trump has continued to push for this bill to be passed by July 4th. In our interview, Levine criticized this quick turnaround for a bill of this magnitude and credited most of these changes to a lack of research into their actual impacts. Whether the House meets that July 4th deadline is still up in the air. I've reached out to all of our elected officials about this bill and its potential impacts to rural health care. You can find their statements on our homepage at WCYB.com.